Hello, I'm the researcher Hanin Saadah, a student at the Department of Natural Engineering and Technology Sciences at the Arab American University in Palestine. Today, I'm going to present the paper which is titled with Convolutional Neural Networks, Breast Cancer Classification Using Palestinian Mammogram Dataset. This was a collaborative work between 3 authors. So as a start, I will present an introduction about the topic and the problem statement. I will present also the objectives, the contribution, the related work, methodology, results and discussion, and finally conclusion and future work. So as introduction, breast cancer disease is widespread globally. It's considered one of the leading causes of death in cancer mortalities. According to the Ministry of Health annual report in Palestine, as you can see in the chart below, it ranked as the third reported death of all deaths in the West Bank in 2021. Breast cancer has many symptoms and risk factors that can help in developing the cancer disease. There are various ways of diagnosing breast cancer abnormalities, but the most common one is mammogram technique for screening. So we have also the BIRAD scale, which is a standard scale that stands for breast imaging reporting and data system scores used for mammogram image classification. Lastly, machine learning plays a crucial role and important role in medical imaging processing, especially in early detection when the treatment is affordable and available. Here is a screenshot of the BIRAD scale that has 6 scores, including 0, because 0 it's considered as incomplete assessment. The findings from BIRADS 1 to 3 are most likely benign, while the chance of having malignant findings in 4 and 5 is up to 95%, as we can see on the right column. Finally, score 6 indicates a proven malignancy. This scale was developed by American College of Radiology in 1993. The problem statement, we have computer-aided detection system based on machine learning that can enhance the performance and accuracy of breast cancer screening. Also, there's a shortage of resources, including well-trained doctors responsible for interpreting mammogram. As a result, it will cause a delay in diagnosis. Besides, the number of women seeking mammogram screening has increased in recent years. Therefore, it's a challenge, and there is a need to introduce a valid and accurate approach to read mammogram and interpret mammogram images. The main objective of this study is to develop or to implement machine learning models based on convolutional neural networks to detect breast abnormalities at early stages. There are a lot of sub-objectives, and which is like collecting a local data set and using a data set in different approaches to build an optimal CNN to classify mammogram and help the medical staff to interpret their data. The main contribution of this study is collecting a first-hand dataset from the Palestinian community and implementing different models to classify mammogram into normal and abnormal. For the related work, many machine learning methods were used in literature, with most applications based on deep learning techniques, particularly CNN. These applications used common public data sets and classified images into normal and abnormal classes, and other researchers used hybrid models with different pre-processing methods. Our methodology in this study went through 6 phases, starting from collecting a local dataset, pre-processing, analyzing the data, and extracting insights, splitting the dataset into 2 subsets, followed by modeling using 6 CNN models, and finally testing the models with different performance measures like accuracy, recall, Afon score, and precision. First of all, the dataset was collecting from Beit Lahem Mammogram Center before July 2023. It consists of data from 174 ladies with a total of 813 images, primarily in JPG format with a few in DICOM that was later converted to JPG. The images with a standard size of 4,710 by 5,844 are captured into two views, mainly mediolateral oblique MLO and cranial caudal CC, and was taken from both sides of the breast. Here is an example of the CC and MLO views in mammogram. We can see that the pectoral muscle in MLO view is showing clearly. In the pre-processing stage, the data was labeled into normal and abnormal. Then two balanced random samples were taken from the original data set. Each sample has 100 images for the normal and 100 for the abnormal. The images included annotations such as text and extra objects like the pectoral muscle, and these were cropped manually. All images later was converted to grayscale, and in addition, all of them were resized into 224 by 224 pixels and were normalized. Lastly, many augmentation techniques were used to enlarge the sample size. Here's an example of mammogram image before and after pre-processing. In the top left image, the original and the pre-processed image on the right. The second and third rows illustrated the resized and augmented images. In the exploratory data analysis, which is the EDA stage, insights were extracted from the data. The following slides will present some of them. First, the chart illustrates the distribution of screened images among the age group and normality keys. The majority of screened images, as we can see in both classes, are related to the age group from 50 to 95. This figure presents a chart of the number of screened images versus class and the size of breast. It can be noted that the largest number of images were taken from women with the possibility of cancer cells on the left side of the breast, and this group constitutes half of the sample, while the number of images taken from women with the possibility of cancer cells on the right side is less. Similarly, this chart is showing the number of images taken from the CC and MLO views and how they are distributed between the normal and abnormal classes. In the modeling stage, 6 deep learning models based on CNN were used and implemented, and these are DenseNet 121, VGG16, VGG19, Xception, ResNet 15, and lastly, EfficientNet B7. This slide shows the architecture of the first three, which are DenseNet 121, VGG16, and VGG19. This slide also shows the architectures of Xception, ResNet 50, and the EfficientNet B7. In this approach, the sample data set of normal and abnormal was the input of this model. The images were pre-processed as explained earlier. 80% of the pre-processed images were fed into the 6 models. After that, the model's parameters were tuned to enhance the initial results and produce the final trained model. Later, the testing subset and the external data set were fed into the trained model to get the classification. Here is just an overview of the hyperparameters tuning. These were the parameters that were tuned during the modeling process, which are batch size, activation function, optimizer, learning rate, number of epochs, and the regularization. Here is the results and discussion. Based on the experiments, we found that DenseNet 121 outperformed other models in detecting abnormalities. Table 2 lists all obtained results from performance measures versus models in the testing subset and external dataset. It can be seen that the accuracies in the testing and external sets range between 0.83 and 0.50. In the testing subset, DenseNet 121 outperformed all other models with the highest values. EfficientNet B7 showed closed results for the DenseNet. In the external dataset experiment, DenseNet 121 also produced the best results in terms of performance and outperformed other models. This is the confusion matrix for DenseNet 121 in both experiments in the testing subset and the external dataset. In the conclusion, breast cancer is the top one common cancer in women globally and ranks first as a cause of death in cancer deaths. Many symptoms and risk factors can help in developing breast cancer. Mammogram screening is the most common and efficient method to diagnose breast abnormalities. We implemented 6 CNN models in this study and also used testing subset and external data set to test the performance. In a conclusion, DenseNet achieved the highest testing accuracy in both experiments. As a future work, a large data set of mammograms should be considered and a repository should be created for these kinds of tasks. Automating also pre-processing by using, for example, morphological transformation provided by the OpenCV library in Python. These models should be integrated with other patient data, such as genetic information, lifestyle factors, and medical history to assess the individual's risk of developing certain diseases. And this, of course, enables the proactive measures such as preventive screening or lifestyle modifications to be taken for individuals at a higher risk. And these are just an example or a short list of the references used in this study. The whole list can be found in the paper. And thank you.